So thank you, colleagues. Let's keep it calm and professional. A few questions of the lab. As always, we're working round the clock to improve lab capacity across board. A big constituency that we're looking at how to bring in are the private sector labs. You know, we have nothing against private sector labs supporting the testing. The reason why the number of tests in South Africa are so high is because their private sector labs were ready to carry out molecular testing. So we've had very few applications, maybe one or two, and what we're now trying to do is define those guidelines. We put them up on our website, and once a private sector lab is able to do the complete package of testing, the biosafety, by all means, we want them to go ahead, and if they want to charge, that's all well and good. The important thing is we get the data on the number of people tested. But for labs that we're going to use public sector resources to support and provide the reagents, there's no commercial pipeline at the moment to buy reagents. So we bring in all these reagents through procurement, donations from the UN. Once we distribute that, then we have to maintain the standards across those labs, and that is what we will continue to try to do. Thank you for the information on University of Jos. We have quite a number of places now that are offering this. Teams just came back from Port Harcourt and Yola that just came online. Then Nnewi at the moment, the next destination is Kwara and Katsina. So we keep pushing, but you know, we keep pushing and we try and cover as many labs as possible next week. The rapid diagnostic test kits. To be honest, I've said this severally. Once there's a rapid kit that we know works, you know, we have rapid kits for malaria, for HIV. They took years to develop, right? We're 3 months into this disease. So also speed is not always an advantage, right? So we're working very hard with studying the evidence. As soon as there's a rapid test kit that works, we will offer it, we will say, listen, this is a test kit that works. But we don't have that evidence yet. So I know that people procuring, my responsibility, whether it's good or bad, is to provide the best scientific advice I possibly can to my government, and that's what I'll continue to do. There are pressures on the commercial side, on the ease of doing business side, to approve kits. But my responsibility is to make sure that whatever we're using provides healthcare professionals the answers they need to make informed decisions about clinical management. So the other question on malaria and COVID are different. I mean, I won't go into that. That requires some attendance of medical school to go into all the differences. But I think we all know COVID is a respiratory illness caused by a virus. Malaria is caused by a parasite. They are completely different diseases. However, many diseases in our context present exactly the same way in the beginning, right? Yellow fever presents the same way with the fever at the beginning. Lassa presents the same way. Malaria presents the same way. So the initial presentation of a febrile illness is very similar across diseases. There's no specific treatment for COVID. So what clinicians do is to manage your symptoms so that the body recovers as quickly as possible. So sometimes they try, if you have, because you can have malaria and COVID. So by the time you're in hospital, there's no reason why that you have COVID doesn't prevent you from having malaria. And if you're in the hospital for 1 month, you know, you could definitely be co-infected by both of them. So there are very many reasons why people receive similar treatments here and there. But there are two completely different diseases with different pathogenesis. On the result of the patients in KEFI, yes, you know the right thing to do. The clinicians can inform us if there's any problem through their state epidemiologists. The chair of the task force for the management of COVID-19 in Nasarawa State, Dr. Akabe visited us last week. We talked about the general response to the outbreak in Nasarawa. They're trying very hard to improve that. But I obviously can't comment on the results of one specific individual, and definitely not at the press conference. The drop in the number of cases You see, it's never good to interpret rises or drops in days. So when you see 1-2 days of an increase or a decrease, you will never see me come out and say cases have increased or decreased. We look at trends over time, and we will continue to monitor this over time. And if we do see a consistent decrease, then we'll be happy. But it's way too early to interpret results on a day-to-day basis. We rather take it on a week-to-week or 2-week to 2-week basis. There was a request by a number of tests by state. That request has come severally through social media as well. And next week we'll provide the number of tests in every state per week. So that you see that. We will try and provide that every week. We won't make any comment on it. You interpret it the way you deem fit. We'll put the number out there so that people can come to their own conclusions on who is testing and why not. There's a question on the circumstances of the death of the individual that came in from Dubai. I mean, this was a very unfortunate scenario. We lost someone. Every death is a really sad occurrence. But the clinicians, the managing clinicians have communicated with the family as they should do. They understand the circumstances, and I think they're at peace with each other. So I think that's sufficient to say at this stage. There was a request for specifications for masks. We'll do our best. Remember, the best thing to wear actually the safest thing are the blue, simple masks that you're all wearing, or these improvised masks. And the key thing about these masks is really the safety, to keep them washed every day, to take them out safely. You would have seen me when I do it, pick it out from your ears and not open it, don't share them, generally keep them as safe as possible. But we will see what we can put out there if that's a request by Nigerians. We're there to serve. And finally, there's the question on Borno, on why they have eased the lockdowns in Borno. I think every state governor that's exactly what they're elected to do, to manage these circumstances on behalf of their states. We provide guidelines from the federal level, but the enforcement and of these and how that relates to your particular state and the circumstances in your own state can only be decided on by the state government. So I was asked to also answer that in Igbo. I say, Onyisi ala Borno nyawa jiakia welie iheji mgbochi maka ndị mmadụ ịgagharị. So ọkwa n'ihe ji họpụta ya ka ọ chịa ndị Borno, ọkwa n'ihe ji họpụta ya ka o mee. So thank you very much. I think that answers all the questions. Okay, Rachel, which question did I not answer? Yes, absolutely. I need us to remember. Today on social media, there's been a lot of noise. I think there was a case somewhere in Enugu that NCDC did not pick up an individual. I think we're very proud of the work that we have done so far. We will continue to work very hard to improve the work we're doing in collaboration with everyone else involved in the response. But remember, NCDC doesn't do everything. The collection of people when they're ill, or the collection of samples are a state government responsibility. We provide them guidance, we provide them when we can, the swabs, but the actual sending someone to the patient to collect a sample, picking up the patient when they're ill, are state government responsibilities, and we continue to support them. They're working very hard to do this. It's very challenging. Every day at night when we announce the new numbers for a state, the first thought that comes to my mind is, gosh, Lagos has to find space for 60, 70 new patients the next day. Or Kano has to find a space for 50 new patients the next day. So it is not easy organizing all of these things. And I know the states are working very hard on this. But this is their responsibility. Ours is to support them to carry this out.